Welcome. Today is November 9th, 2024, and this is Wondrous Roots, your health from the ground up. My name is Becky Montrone. I have a business here in Keene called Wondrous Roots, where I practice as a holistic healthcare practitioner. So I see clients in private consultation regarding all kinds of health problems, from wellness to serious, severe illnesses such as cancer, and just about everything in between. I always love a good challenge, as many of you know. And I enjoyed sleuthing out medical mysteries. How's that? Trying to find out many times. Sometimes, you know, you can get some very interesting constellation of things, and try to get to the bottom of them can be a lot of fun for me anyway. Sometimes it takes some patience on your part while I do it. But anyway, so we are here. We're located in Keene, New Hampshire, which is in the Monadnock region of New Hampshire, close to the Vermont border, Vermont and Massachusetts corner. And we are in the Miller Forge building, which is an old mill building up on the 3rd floor on Roxbury Street, which is one of the major roadways coming off Central Square in downtown Keene. Our number here is 603-439-2603. You can also reach out to me from either of our websites, shopwondrousroots.com, wondrousroots.org, and go to contact us and type in there, and it will come to my private email. So I think we're open 9:30 to 5, Monday through Friday. We will be open on Veterans Day, Monday, which is a federal holiday, and I totally honor our veterans, but I can't be of any use to them by keeping my doors closed. So I'm going to stay open and help those who are still on this side as much as I can. So we will be open on Monday. And what else do I want to say? I think that's probably it for now. So I'm going to delve in. I talked last week about palmitoyl ethanolamide, PEA, which I was really excited to talk about. If you missed that, you can go back to my page on wondrousroots.org. If you go to research files, you go down, you scroll down, and you'll see the heading palmitoyl ethanolamide. I think I'll do that anyway, share my screen just briefly, but first I'll tell you how to participate in case you're new and you don't know how to do that. You can type into the chat. You can type into the Q&A. You can raise your hand and then speak, and we will hear you. So I think that's it. I'm just going to share my screen briefly and show you what I was talking about. As I share to begin with, end up with my newsletter from today, which is kind of what I'll be working off of today as far as, anyway, but I'm going to go to my website. Okay, research files. You can see this is getting pretty long. I think I'm going to have to break it up by, into a couple of different ones by alphabetically. And then I added just this morning, because I'm talking about boron, I added this one, which is nutrients, vitamins, minerals, amino acids. So this is kind of like nutrients that really I don't want, I don't want to devote an entire page to, but I want to get on there. So it's going to be a very long page, but I started it today because I'm talking about boron. So what I'll do is I'll just keep moving these things as, so they're alphabetical. So, but anyway, that's new. But then, of course, there are some nutrients and minerals and things such as lithium, right? Such as magnesium that have their own page. But then this will be kind of a catch-all for other things. So that's how I figured out how to do that. But what else did I want to show you? I took you here to show you, oh, yes. That's where you'll find the palmitoyl ethanolamide page. So that PEA, palmitoyl ethanolamide, really remarkable. And if you go here, I talk about it very briefly there, but if you go here, you can then see that presentation from the last time, and then you click here, you can get the whole PDF with the links that you can follow and stuff like that, and then a lot of info there. Okay, so I might as well just stay shared with my screen since I'm here. And there we go. This is today's. So anyway, I've told you that I've been wanting to talk about a few things that don't take up like a whole program, but they're very interesting. They're very interesting to me. And things come back onto my radar, like my right there radar, when I'm working with somebody that a certain something will pertain to. Somebody that I might want to use something with, and I'm like, yeah, like, why haven't I been using that with other people? Why haven't I remembered to use that with so-and-so? Why haven't I emphasized that in, my own protocol or whatever? So I'm just going to dig right in. Again, you're welcome to participate, and you just get there we go. You can see everybody. Just want to make sure I can see everyone. Okay. All right, so boron is a mineral. Let's just go straight down here. Again, I say, as I work with people today, day to day and encounter various health issues, certain nutrients will come to mind. And as I ponder them in my mind, I become more and more amazed with the power of nature when it comes to our health. So today, let's talk about boron, never boring, for bones, healthy teeth and gums, hormonal balance, men's health, arthritis, inflammation, more really. And then inositol from fertility, and to weight loss, to relieving anxiety, panic disorder, and depression. And inositol is considered vitamin B8, has been called that. But because we make it in our own bodies, it's not technically a vitamin. It's considered, some people will call it like a non-essential vitamin. But we can use it in therapeutic doses to achieve therapeutic benefits. So I'm going to be talking about that. All right. Again, if you want to talk about anything else, please feel more than free to chime in, and we'll take it off in that direction. So I always love that. I love doing that. Okay. So boron. Now I had put in, I did that on my webpage. So let me just go there. Let me go back here. Well, no, I mean, I thought for sure I put it in my newsletter, but that's okay. All right. Well, the element boron is denoted by the symbol B, has the atomic number of 5. It plays a crucial role in various industrial applications and also has relevance in biology. It is a metalloid, meaning it has properties intermediate between metals and non-metals. Okay, so I think that this one is a good one to start. Maybe this is a good one to start out with. Nothing boring about boron. The trace mineral boron, let me blow that up a little bit. The trace mineral boron is a micronutrient with diverse and vitally important roles in metabolism that render it necessary for plant, animal, and human health. And as research suggests, possibly for the evolution of life on Earth, which I would totally disagree with. I would say that God created boron when he created the Earth, but I digress. As the current article shows, boron has been proven to be an important trace mineral because it is 1, essential for growth and maintenance of bone, 2, greatly improves wound healing, 3, beneficially impacts the body's use of estrogen, testosterone, and vitamin D, which is also a hormone, so that hormone balance in the body, boosts magnesium absorption, reduces levels of inflammatory biomarkers such as high sensitivity C-reactive protein, which we see in relation to, many times it's a marker for cardiovascular disease, and tumor necrosis factor, TNF2, tumor necrosis factor alpha. Raises levels of antioxidant enzymes such as superoxide dismutase, catalase, and glutathione peroxidase. I got to say it. I have to say it once every program at least. Protects against pesticide-induced oxidative stress and heavy metal toxicity, which glutathione does. Improves the brain's electrical activity, cognitive performance, and short-term memory for elders. I guess that would be me. Influences the formation and activity of key biomolecules such as acetyl-methionine, SAMe, and nicotinamide adenosine dinucleotide, NAD+. So think about NAD+ as mitochondrial, boosting your mitochondria. SAMe, acetyl-methionine, which we make we convert when we take sulfur, like MSM, those of you like me who are using MSM, then we make, in that methylation cycle, we make SAMe, acetyl-methionine, which is used to help with depression. Some people will take SAMe as a nutrient, as like an antidepressant. Has demonstrated preventive and therapeutic effects in a number of cancers, such as prostate, cervical and lung cancers, and multiple and non-Hodgkin's lymphoma, and may help, and multiple, they're talking about multiple myeloma, I would think, may help ameliorate the adverse effects of traditional chemotherapeutic agents. Okay. In none of the numerous studies conducted to date, however, do boron's beneficial effects appear at intakes less than 3 milligrams. And so we're going to talk about that. We're going to talk about like ideal levels for different things. But what I find, what I would say to those of you who are using like the Thorne basic nutrients, there are 3 milligrams in the Thorne basic nutrients, but I use boron on top of that. In fact, I walked out of my office yesterday and I have 1 bottle on my shelf. I've got a bunch more in my cart to order to be delivered for next week because again, I have a lot of people using boron. It's very inexpensive. It's like $8 for 100 capsules, but of 3 milligrams each. But anyway, we're going to go into more of the things in detail that it does for us at this moment. So let's see, we'll get out of that one. Speeds up wound healing. We'll blow that up a little bit. Maybe move it over just a bit. Chronic wounds. So they use this topically. So I'm not going to go into that property of it, but it would be a good thing for you to be taking if you are trying to heal from some sort of an injury, whether it be wounds that are in your skin or your soft tissues, or wounds that are in your bones. You've had a sprain or a break or a fracture, that kind of thing. Further, okay, so it says, let's go, the review. This review article comprehensively investigates the mechanisms underlying the beneficial effects of boron compounds in wound healing. Boron exerts its healing properties through multiple pathways, including anti-inflammatory, antimicrobial, antioxidant, and pro-proliferative effects. So that would be proliferation of, say, your bone tissue as it's regenerating, right? You've had a fracture or whatever, or bone tissue in general as you need to replace diminished bone, or yeah. Inflammation is a crucial component of the wound healing process, and boron has been shown to modulate inflammatory processes by inhibiting pro-inflammatory cytokines and promoting the resolution of inflammation. So you have inflammation that comes in to help when you've have a wound, and it comes in, but then it needs to back off, right? It doesn't need to keep driving. And we talked about that with regard to palmitoyl phenolamide last week as well, that kind of like, you need to go there, and then PEA in your body, because we make it, will go to sites of inflammation to help modulate the inflammation and stop that inflammation from becoming an ongoing burning fire, resulting in many times chronic pain or other chronic health problems. It exhibits antimicrobial activity against a wide range of pathogens commonly associated with chronic wounds, and thereby reducing the risk of infection and promoting wound closure. So I would say, we look at wounds that are superficial, lower leg kind of thing, venous stasis ulcers maybe, or, that can become infected and become a haven for mycocillin resistant staph aureus, MRSA, that staph infection that's really hard to treat, and sometimes people just can't get rid of it. So I would put that as an application here, and would think that using boron, say in the clinic or something like that, as a topical in the properly balanced solution would be a smart idea. I have to actually look at that, being a formulator myself, right? Like, why wouldn't I look at how you put up a boron solution, right? That's the right strength. So you're not like boroning, burning somebody or anything, but something that's safe. But that's what I do. That's how I like to learn and find out. Maybe we'll come up with something that's just really good to apply topically to a wound. or maybe it could go into a healing wound salve. Very interesting. I never thought about that until right now. The antioxidants properties of boron help protect cells from oxidative stress, a common feature of chronic. So actually boron, right, would be a good addition to, like, we use our Wondrous skin for healing bed sores that won't heal. And it works really well, but I'm thinking like a variety of that with added boron for that type of thing, because it helps with wound closure. Very interesting. Well, anyway, the wheels are turning. The antioxidant properties of boron help protect the cells from oxidative stress, a common feature of chronic wounds that can impair healing. Additionally, boron stimulates cell proliferation and migration, as well as essential tissue regeneration and wound closure processes. So again, that cell proliferation, so helping you build those tissue cells back up. You've got a gaping bed sore, right? Or something like that. You need to, that skin needs to now regranulate, and, you know, it needs to come back. And you need to have a production of those cells for new skin. Let's put it that way, for new skin. Okay. All right. More overall. Okay. So very good for that. Improves gum and teeth health. I just went to a general page here because the one that I saw that was really talking about, they can use it in dental. They can use boron actually in dental applications, like the dentist office, but I didn't want to get to that. I kind of wanted to get it more like how ingesting boron can help our teeth and gums. Got strong teeth, you may have boron to thank. Boron plays an important role in healthy teeth, gums, and prevention of tooth decay. By converting the vitamin D to its active form, it increases calcium uptake and absorption into the bones and teeth. If you do have tooth decay, you can try kicking up the amount of boron in your diet or via supplements. So that makes a lot of sense. So this is one of the things we have to do to keep our teeth strong. Calcium is very important, but you don't want to just flood yourself with calcium. Where does it go? It goes all over the place. So, right, the boron helps you absorb it in your bones and in your teeth. And converting the vitamin D to its active form, it plays a role in all of that. So I think that's pretty exciting because dental health is super important. Prevents vitamin D deficiency. Upregulatory impact of boron on vitamin D function. Does it reflect inhibition of bloody-bloody-blue? But anyway, I guess the bottom line for us is that it helps increase our vitamin D absorption. And we're going to see that in a minute when I go to another article. So I'm not going to read through all of that, those long things. But the point is well taken. We say, okay, my vitamin D is low, right? So what do I do? Well, load up on a lot more vitamin D. But how about increasing boron so that we're increasing our absorption of vitamin D into the tissues where they belong? And then reduces inflammation. We talked about that a little bit with the wounds there. Plasma boron supplementation, comparative effects of daily and weekly boron supplementation on plasma steroid hormones and pro-inflammatory cytokines. And here, this is actually, yeah, I was going to allude to this using that other study I was just telling you about, the vitamin D. And I won't go through that study, but this again, just sort of, again, here we have some scientific validation of the use of boron for getting after inflammation in the body. And, but I'm going to go in from here, I'm going to go to this one, because this is kind of getting at the facts there. So I am going to read through this one. So what is boron? Can kids take it? Yes, Debbie, kids can take it. They would take a lower amount, right? But we all need the trace mineral. Absolutely. I can get back to you like with a dosing for a child, but yeah. So boron is a trace mineral, is crucial to human health and boosted testosterone levels. But oddly enough, there is no set recommended daily allowance. That said, now we're talking about men wanting to increase their free testosterone. What's really interesting is we're going to find it doesn't increase total testosterone, it increases free testosterone, which is really great, by decreasing estrogen and by down-regulating something called oh gosh, steroid hormone binding globulin. So anyway, SHBG, we call it SHBG. So it says here, that said, 10 milligrams supplemented daily appears to be the sweet spot for your testosterone, according to a recent study. Any less than 6 milligrams, and you may not get much benefit from it with regards to your testosterone levels. However, now what's really very interesting is working with men with prostate cancer or working with men with prostate concern. They're working also with their doctors or whatever. They don't want to do anything that raises testosterone. They're all about the hormone shots. And I'm not going to argue that just annihilate your testosterone. And yet we find boron works to lower PSA. Boron works to prevent prostate cancer. So the testosterone subject surrounding prostate is a bit murky and complex. But this is very interesting because you would say, well, maybe I'm not supposed to do that because doesn't high testosterone lead to prostate cancer? And I would say no. Again, it's a much more complex topic. But any less than 6 milligrams, and you may not get much benefit with that regard. However, there is no evidence that more than 10 milligrams is beneficial. And in fact, trying to supplement with high dosages, say 20 milligrams daily or more, could be harmful. And I top everybody out at 12. Guys, I have topped out at 12 because they're usually getting the thorn and they're getting 3 there, but then I have them do 9 more because, excuse me, we want to reach 10. And 12 is safe. Anyway, blah, blah, blah. Boron increases free testosterone. The effect of supplementation on free levels of testosterone is pretty incredible. Males given a daily boron supplement of 10 milligrams every day for 7 days. So this went on just for 7 days. Realized an outstanding 28.3% increase in their free testosterone. Perhaps just as impressive, their estrogen levels dropped 39%. Now that is amazing. And that's really huge because this is, it's this conversion of testosterone, free testosterone to estrogen, which is what gives men their man boobs and gives them trouble with their sexual function, erectile dysfunction, that kind of thing. They've got the testosterone, it's getting converted to estrogen. And that's something, again, that we're seeing. I think most men are going to ultimately have problems with this because we are in this estrogen-driven environment. We have estrogen in our food supply, in our sunscreens, in the air we breathe, and the pesticides that people spray on your neighbor's spraying his, Roundup on his lawn or whatever. We've got estrogen in our soft plastics. So we are really kind of feminizing the whole entire population, if you will. And men, it's the estrogen, I will argue, that is responsible for the prostate problems and cancer, not testosterone. And for that, we use iodine and we use, anyway, I won't get off on that for now. We'll stick to this topic. But anyway, 39% decrease in estrogen. This is 7 days on 10 milligrams of boron. I would like to see more studies, this author says, done with supplementation of 10 milligrams over a longer period. But when you see testosterone levels go up and estrogen levels go down that much, it's impressive. Scientists want to see if boron supplementation could increase vitamin D levels in people suffering with low vitamin D levels. Vitamin D is also critical to testosterone. And the researchers also measured testosterone levels in the study. Participants were given 6 milligrams of boron per day for 60 days from calcium fructoborate, which is just the source like on the back of the label. I think that's the source on the boron I have. After the 60 days, researchers found that vitamin D levels increased 19.5%. So their vitamin D levels increased that much of a percentage point without adding vitamin D. DHEA, another one of my heroes, increased 56%. And that's so interesting too, because boron is so good for bones, but so is DHEA. And so is vitamin D. So maybe that's one reason why boron is so good for the bones, right? Because it increases those other things. Then free testosterone increased 29.5%. Okay. So while this is the kind of cool thing. While free testosterone shot through the roof, which is crucial to your ability to gain muscle, lose fat, and increase strength, that's the testosterone you want, total testosterone did not get a significant increase. If you're anything like me, this author says, you're probably wondering how on earth free testosterone could take such a big jump while total T remained relatively unchanged. That is because of the crucial interplay between boron and sex hormone binding globulin. I said steroid, but sex hormone. Yeah, because those are steroid hormones in the blood. Sex hormone binding globulin is a protein made by your liver. Its job is to bind to mission your sex hormones, estrogen, DHT, and testosterone, and carry them throughout your body via your bloodstream. Overall, this is a good thing, as SHBG, sex hormone binding globulin, helps to keep your body regulated. However, as testosterone increases, so do your SHBG levels. Just because your testosterone levels are increasing, your body's ability to use it for things like strength and muscle building could still be limited because it's being bound by SHBG instead of being free. So you could just say, hey, I'm going to go get testosterone shots. And see what that does for me, for my bodybuilding and my sex life and all of this kind of thing. But because of this SHBG, you have got, you're still binding that hormone and you're not getting the benefit of it. While boron simply takes the testosterone you already have, your total testosterone, and keeps your free testosterone that does all of those things up there, keeps that level up there. So I think that's really cool. It says, I was unable to find a single human case study showing positive effects of supplementation with less than 3 milligrams per day. In the best human study on boron and testosterone, the dosage use was usually, what used was 10 milligrams per day. So you definitely would want to do that in a supplement form. Okay, so good on that one. So again, reduces inflammation, balances hormones, increases bone and joint strength. So let's hop over there. Again, emergence of boron is nutritionally important throughout the life cycle. Like, have you guys ever thought of boron? I mean, a lot of people probably haven't. Again, it's a trace mineral. In 1997, it was predicted that boron would be identified as an element with practical nutritional or clinical importance by the year 2000. Research findings since that time indicating that boron is needed or beneficial for many of life processes included embryogenesis, so helping your embryonic development in newly forming human beings or animals, I would say as well, bone growth and maintenance, immune function, psychomotor skills, and cognitive function suggest that this prediction will become true. The surprising thing about this development is that only 20 years ago, students in the biological and medical sciences were being taught that boron was essential for plants, but not for animals. Wow. It makes you think how recent some of our scientific understanding really is. I mean, I would think that would be back in the 1800s, people would know that, right? But not so, not even in the early 1900s or mid 1900s. In fact, at that time, the first report about the possible nutritional importance of boron appeared. Boron was generally regarded as an element of only toxicological concern, like especially in the hospital setting, like too much or having too much of it somewhere where it doesn't belong. Now that the opinion about nutritional importance of boron is changing, a question that has come to the fore is, why wasn't this recognized sooner? Okay. A reasonable answer to that question is that boron apparently has a biochemical function that is very subtle. Moreover, this role apparently is one that allows optimal functioning of other nutrients or hormones and thus is overlooked as attention is directed toward altering the intake of the substance whose suboptimal metabolism is directly involved. Okay, that's exactly what I was just saying. Okay, so maybe the reason it's helping the bones, right, is because it's raising DHEA and vitamin D absorption and raising DHEA levels and vitamin D levels. But we're thinking, oh, those are the things we need. So we use DHEA and we use vitamin D, but we don't use boron because boron is like that subtle instigator of those things. Very, very interesting. Embryo development in growth, boron in growth and development, boron in the adult. See what we haven't looked at. I think I was looking at this for a particular reason. This is hormones, bone and joint strength. Maybe that was it. But anyway, you can see, again, this is very exciting, actually. Prostate health. Yeah. So I think I first want to go to a different one on that one. Let's go here to this one. Oh, this is a good one on bone health. Okay, let's go there. Pivotal role of boron supplementation on bone health. It says here, the studies considered in this narrative review have evaluated the positive effectiveness on bone in humans through control of calcium, vitamin D, and sex steroid hormone metabolism, considering a dietary supplement of 3 milligrams a day of boron alone or with other nutrients. This supplementation is demonstrably useful to support bone health in order to prevent and maintain adequate bone mineral density. Also considering the daily dose of 3 milligrams is much lower than the upper level indicated by EFSA and the daily dose of 10 milligrams. And I would say, I would honestly go for 10 milligrams for people, men or women looking for help with, bones and that kind of things. I would say definitely for women between, I would say 9 and again, 9, 10, right around there. I would say around 10 milligrams. But again, kind of making all of these things cohesive, making these hormones and minerals working together. Okay. I think this is the one I wanted to go to next, and then I'll go to the other one on prostate health. So does boron reduce prostate cancer risk? Substantial, and this is so interesting, right? Because boron increases your free testosterone. So most people in oncology today, most of your oncologists, if you have prostate cancer, are going to tell you, do everything you can to get rid of testosterone. I've actually have a man with metastasized prostate cancer right now, and he's working down at Dana-Farber, and he's working with me and the integrative health specialist down at Dana-Farber wanted him to go off melatonin because of its impact on testosterone, off DHEA, even though I have demonstrated that DHEA, men with prostate cancer have less DHEA. That's, so, I won't argue about the DHEA. Wanted him to go off glutathione once he starts chemotherapy because of the misunderstanding about antioxidants and chemotherapy. So, anyway, I'm going to be communicating with this doctor down at Dana-Farber and pointing out studies to show the error of his ways, but I'll do it very professionally. It's very important to understand not to pull the rug out under people because you're holding on to old science that hasn't been updated in your repertoire of knowledge. So because here we have boron is working, that would be the natural knee-jerk reaction of modern medicine's look, oncology department look at boron would be, oh, well, we don't want that. But it says here, there are many nutrients, including minerals, that can reduce the risk of getting prostate cancer and improving prostate health. There's not, however, a single magic bullet, of course, blah, 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 blah. In recent years, there are many studies that demonstrate that boron compounds have been found to kill prostate cancer cells while leaving healthy cells unharmed selectively. That's what glutathione does. So when you have when somebody's going for chemotherapy, the oncology concern is, well, we're trying to kill the cancer with oxidative stress, and glutathione is the biggest antioxidant. So you can't use it, right? Because then it's going to stop the chemotherapy from working. And that's wrong, because when you take glutathione, when you increase glutathione in your body, it depletes the cancer cells of their glutathione that protects them. from the chemo and radiation, making them more vulnerable, but it adds protection to your cells that don't have cancer, preventing them from becoming cancers and helping protect against the side effects of the chemotherapy and the radiation. And that is borne out in scientific study, but it hasn't reached the hallways of the oncology departments in some of our top cancer hospitals around the country. It's really too bad, because they could be making things easier and better for people if they would use it as part of their treatment. So anyway, can boron lower PSA? In addition, boron has been found to lower PSA. PSA was previously believed to be only a marker for benign prostatic hyperplasia and prostate cancer, but more research shows that elevated PSA levels are actually a causal factor in prostate cancer progression. So prostate PSA levels are not only in like they show that you've got a problem here, but they can actually amplify that problem. So very little blah, blah, blah. This means anyway, so we can see that adequate boron levels are associated with a 64% reduced risk of prostate cancer. So again, getting that from food is difficult. Don't rely on the food. Go for supplements. Okay, so you can just see, very important, a nice balancing act. Boron, the balancer, maybe we could say something in that regard, in that line. Now, inositol. Inositol is very interesting. It's one of the B complex. It's a form of sugar that our body needs for cell growth and development. It's also something that we make ourselves in our body, but using more makes it therapeutic. Can also help with metabolic syndrome. So think, high blood sugar, diabetes, pre-diabetes, that kind of thing. PCOS, did a whole program on that, polycystic ovarian syndrome. So it has a very nice effect on modulating the hormones. Gestational diabetes, so when women have diabetes during their pregnancy. Depression and other conditions. So we'll go to a little bit of an overview here. This is really good. I'm generally not thrilled with Cleveland Clinic kind of information, but this was really one of the best papers, best overviews I found on it. So I'm going to go through that. Blah, blah, blah. I just kind of did that. Inositol is a form of sugar your body naturally produces to provide structure to your cells. It can also be found in certain foods, including meats, fruits, corn, beans, grains, and legumes. The typical American diet contains 1 gram of inositol a day. But research suggests that taking an inositol supplement may have many health benefits. Frequently called vitamin B8, but it's not really a vitamin. Okay, blah, 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 blah. Now, in addition to playing a role in the development of your cell membranes, inositol may also have an effect on insulin and certain chemical messengers in your brain. This may influence your body's ability to manage metabolic and mental health conditions. As a supplement, inositol is commonly known as myo-inositol, D-chiro-inositol, or inositol hexaphosphate. And typically, I use with people myo-inositol. It's a very active form. Your body needs inositol for the functioning and development of your cells. While research is still ongoing, people also use inositol for many different health reasons. Inositol benefits may include lowering your risk of metabolic syndrome, help relieving the symptoms of polycystic ovarian syndrome, reducing your risk of gestational diabetes and preterm birth, lowering high cholesterol, and I would say not in a negative artificial way, but managing cholesterol use in the body better, thereby managing your lipid levels, balancing your lipid levels, helping your body better process insulin, and potentially relieving the symptoms of depression and other mood disorders. I'm going to go a little bit stronger into that in a little bit. Metabolic syndrome is a group of risk factors that increase your chances for chronic disease, including diabetes, heart disease, and stroke. These risk factors include excess fat in your abdominal area, high triglyceride levels, low HDL, high blood pressure, high blood sugar. By taking an inositol supplement, you may be better able to manage these metabolic risk factors. Some research suggests that you may see an improvement in your blood pressure as well as your triglyceride, cholesterol, and blood sugar levels. So getting all of that balanced getting all of that evened out smoothly. But more research is needed. That's what Cleveland Clinic would say. So don't just go out and start taking it, right? We told you maybe we can find out a drug we can make with inositol, and then we'll write a prescription for it, and that would be much better. Okay, polycystic ovarian syndrome, okay, infertility, irregular periods, acne, weight gain, excess hair growth. I went through that at depth, and I have a whole page on that. If you aren't familiar with that and you're interested, on my website, go to research files, wondrousroots.org, research files, PCOS, polycystic ovarian syndrome, and you'll see a whole PDF and presentation of that. Gestational diabetes and preterm birth can occur when your blood sugar is too high during your pregnancy. Gestational diabetes can cause many complications during your pregnancy and includes the risk of preterm birth. A preterm birth occurs when your baby is born before 37 weeks of pregnancy. Studies show that taking in an inositol supplement with folic acid during your pregnancy may prevent gestational diabetes and lower your risk of preterm birth. Now, this just makes me think of somebody. I have a client who's a type 1 diabetic. She had her first pregnancy at 21 years old. She delivered preterm because of her insulin imbalance, but the baby was super healthy, and she immediately became pregnant with her second. So I've got her, she's doing all her supplements again. But I got to tell her about this because she also has issues with anxiety and that kind of thing. And inositol is great for that, but the inositol could help her use her insulin better because she's, of course, insulin dependent, being type 1. Aha, I have got to get in touch with her and recommend we start adding inositol to her regimen. Depression is a common health and mental health condition. Yeah, so much of that causes a persistent feeling of sadness and loss of interest in activities you once enjoyed. Some research suggests that people with depression have low levels of inositol in their brains. Some studies suggest that taking an inositol supplement might help balance important hormones in your brain, including serotonin and dopamine. More research is needed, but this may help improve the symptoms of depression. So don't wait for the more research if you want to try it. It's very noxious, I would say. It's not a risky thing to try. Be sure to talk to your healthcare provider. So talk to me about that. No, that's not what they mean, but that's what I mean. All right, panic disorder is a type of anxiety disorder in which you may, and this is something that can be hard to address, both with medication and with natural things. So I was really excited to find something that works for this, and we can use really high doses are used for that. I'm going to get into that in a little bit. The higher doses used. You might say, Becky, what do I want to use for a dose for, say, I want to, well, I'll wrap up with that. How's that? I'll wrap up with that because I'm going to go over weight loss and stuff like that. Then I'll do it that way. Bipolar disorder, inositol levels. So something else that can be used. Other health conditions, insomnia, post-traumatic stress disorder, acute respiratory distress syndrome. Okay, so respiratory, that can be very difficult. Type 2 diabetes, obsessive compulsive disorder, again, in the higher doses, and attention deficit hyperactivity disorder, and certainly could be used in children at an appropriate dose. Is inositol safe? It says you might experience these things. I will tell you, I don't think so. I've used it myself at higher doses just to kind of experiment and see how that feels or whatever. And nothing, no change in anything at all. I have some people using very high dose for panic attack, spread out throughout the day. No report of any problems like that. So I would say, they have to say those things, but it's not something that I would be like, oh, be careful. This might give you diarrhea or something like that. I just don't feel that is something, if you started using it and as you ramped up your doses, or they say, you can increase your doses slowly to build up. If you found that, you would say, okay, I'll back off or whatever. But, if your stools get loose, who cares? It's no big deal. Here we have a promising treatment for panic disorder. I think I'll read the shorter one first. I thought that this was quite interesting. Actually, today was the first day I found this one, although I've been referring to other material for this application. So has been found to reduce depression, hostility, tension, and fatigue. So another application I found to it was premenstrual dysphoric disorder, which was something I had a horrible case of back in the day, and I fixed with 5-HTP, 5-hydroxytryptophan, but they also find inositol being very key in that type of a what we call psychosis. Really, it is considered a psychosis that is biochemically controlled. It has nothing to do with somebody not, needing therapy, needing psychotherapy, needing a therapist. It's totally biochemical. So anyway, inositol, vitamin B8 has been found to reduce depression, hostility, PMDD. That form of PMS is actually does cause irritability, hostility, aggression. All right, hostility, tension, and fatigue. It is a folk remedy for anxiety and sadness. Inositol has been shown in very small studies to be helpful for depression and panic disorder, and promising for treatment of obsessive compulsive disorder, eating disorders, very interesting, and bipolar. Researchers have not yet shown any objective benefit when inositol is used with psychotropic drugs. Inositol is part of our diet. Supplementation seems benign since it is. Depression and panic disorder. All 4 sources that discuss it support use of inositol for depression and panic disorder. Writing in Mishkulin and Rosenbaum's compendium, Bellmaker and Levine propose inositol as a standalone treatment for depression and panic disorder rather than as a complement for any other psychotropic drugs, noting responses in the same people and no proven additional benefit from using both in combination. So in other words, that's good. It's like you're getting the same effect whether you add a psychotropic drug to it or not. And that's great because most people don't want the side effects and have to be on medication. Let's just use the inositol alone. So it says the use of adjunctive inositol remains investigated. But anyway, just use it by itself, I would say, if you've got those problems. Though promising due to study design issues, inositol has not yet been established as a treatment for, obsessive compulsive disorder, bipolar disorder, and eating disorders. They found it ineffective in schizophrenia, dementia, and this kind of thing. But I would say very interesting not to rule out and to see if you get if you have those problems, to get a better symptomatic situation. Like if your symptoms are worse, you don't have to wait for a study. Nobody has to come out and say that in order for you to do it, because using it is not harmful. So that's really good. And then, inositol has been the focus of renewed research interest because it is a necessary building block of phosphatidylinositol, a molecule in the brain that plays a central role in the functioning of receptors that bind with several neurotransmitters, including serotonin, norepinephrine, and others. Research findings suggest that inositol taken in doses up to 20 grams per day reduces the severity and frequency of panic attacks by interfering with a molecule called MCPP. The potential role of inositol as a treatment of panic disorder is important in view of the fact that currently available prescription medications are effective in only 2/3 of patients who report panic attacks, have adverse effects, and may lead to dependence. So talking about that, emergency research findings for inositol as a treatment of other anxiety disorders. Findings of several small double-blind placebo-controlled studies show that large doses of inositol improve different anxiety conditions that respond to serotonin reuptake inhibitors, the SSRIs, such as Prozac, Paxil, Lexapro, those kinds of things. Agoraphobia, so that fear of being out in a crowd, and symptoms of obsessive compulsive disorder. A 4-week double-blind crossover study concluded that inositol taken at a dose of 12 grams per day, along with imipramine, which is an antidepressant medication, are equally effective in reducing the frequency and severity of panic attacks and agoraphobia. And 2 small double-blind studies have been done on inositol for symptoms of obsessive compulsive disorder. In one study, patients taking inositol 18 grams per day showed significantly greater improvement compared to those taking a placebo. So that's interesting because that other paper we just looked at said, oh, there's no studies that show that. So you've got to be careful and always kind of go on, if something looks like it could possibly be good, and these are debilitating, this is a debilitating condition you have, no harm trying it. The worst thing is it doesn't work for you, right? You don't have to, small study sizes limit significance of findings, but not always worth trying. I've got somebody with severe obsessive compulsive disorder. What's the harm? Starting with a dose, working up to 12 or 18 grams per day and seeing what that happens. These types of conditions really are debilitating when it comes to the overall quality of life. They keep you from doing things you enjoy, and they keep you, and many times, and in some cases, it can keep you from functioning normally at a job or, you in your home life or whatever. So don't suffer. Again, we call this orthomolecular psychiatry, using nutrients in therapeutic doses to achieve a therapeutic effect. It's really marvelous and wonderful. And so exciting. Okay, now finally we'll get to weight loss. Inositol for weight loss and enhancing metabolic health. Okay. Inositol improves insulin sensitivity by enabling the body to utilize blood sugar more effectively, which is one of the critical mechanisms in how it aids in weight loss, but that's not all. So hang with me. Although often overlooked, inositol is a pseudovitamin, not technically a blah, 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 blah. It plays a significant role in managing metabolic health and hormonal balance, making it a valuable ally in weight loss. In ways inositol could help maintain a healthy body weight, may improve the body's use of carbohydrates and fats, promotes insulin sensitivity and healthy insulin levels, aids in maintaining blood sugar. So Debbie, are you talking about inositol? Madison takes 5, I think you mean grams there. Is that what you're talking about, inositol? So I'll wait until she answers me on that, and I'll come back with it. She was saying kids can take, and I think she's talking about inositol. Promotes sensitivity and insulin levels, aids in maintaining blood sugar, supports cellular health and cell signaling, may help with mood regulation, which in some cases is linked to caloric intake. Yeah, supporting serotonin and stuff can take those carb cravings and stuff away. Supports ovarian function and hormones, which could influence metabolism and appetite. Yes, 500 milligrams, so 5 grams of inositol for a child. So I think Madison is what is she, like about 7 years old now, I would say. But anyway, she's in grammar school. So, and then, okay, inositol. And then Karen is saying, I've been taking Pro-PA double dose, 3 capsules morning and 3 capsules evening. My pain is reduced greatly, but all other symptoms remain. We're talking about fibromyalgia now. Without glycine, I'm having trouble getting to sleep. L-carnitine and inositol arrive today, will begin tomorrow. Choline and serine shipped from UK, not here yet. She's kind of talking to me. Madison is 12? Oh my gosh, no way. I'm an old lady. So are you, Debbie. Anyway, okay. So we, with Karen's routine, with us stumbling upon fibromyalgia looking like the main thing with her, we've added different things. And we took away the glycine because of the fibromyalgia for a certain reason, adding L-carnitine and inositol, but her pain is reduced, doubling her PEA. So that's a good thing to know. That's really good to know, because I have some people with severe pain and the once a day dose is not quite getting where they want to be. Then knowing that you doubled it, that's good for feedback for me. All right, now back to 12. Wow, Madison is 12. All right. May help with mood regulation, ovarian function, that can help. Thyroid function, supports thyroid function, inositol does, which is a primary hormone influencing metabolism. So that's good. Think about that. may help manage appetite and reduce cravings and overeating, making it easier to maintain a caloric deficit that's necessary for fat loss, and may contribute to fat metabolism and adiponectin production, which promotes fat loss and an enhanced metabolism. I kind of wanted to focus down on that one. You actually have promoting fat cells to burn fat cells for energy. And so I think that that's really excellent to know. And I think it also has an effect on leptin receptor problems. Oh, no, that was PEA I was talking about last week. And I had totally forgotten about that. I had totally not known that until I saw that. But anyway, so inositol is also good for weight loss. So, you know, these are problems that a lot of the population has. I could use some I have some depression, some anxiety. I would like to lose some weight. I would like to balance my blood sugar and things like that. And so I would think inositol, no. The PEA is not going to interfere with your sleep. And we can go to some other things to try to help you with your sleep besides glycine, but PEA is not anything you need to back off on. There are no side effects at high doses. So, no, I would say definitely do that. And then we'll have to do work more on the sleep stuff for you. Getting that done. She's one of my very interesting complex cases. All right, so I think that brings us to, dosing. So I was saying how, talk about dose. So the Ova Boost that I have, that I work with women who have polycystic ovarian syndrome or women who are wanting to get pregnant and maybe don't have polycystic ovarian syndrome, I use the Ova Boost, and that has 4 grams of myo-inositol. Debbie was just saying that her 12-year-old granddaughter is using 5 grams a day. They say for like weight loss and stuff like that, maybe 2 grams a day. I say more is better. And especially if you're using this for depression, anxiety and stuff, I would go up and up. Like I would say like maybe 4 grams morning and night. Now you can do it in capsule form. What I have here is capsule form. It's 500 milligrams each of myo-inositol. So if you're doing capsules and you want to go to a higher dose, like I have one woman who with severe panic attack, using 18 grams a day. So I told her to order like the powder, and you know, because that's a lot of capsules. It's an awful lot of capsules, and it's cheap whether you're buying powder or you're buying powder. I'm going to stock the powder too. But like right here, and they make it, all different people make it. I don't see any value, as long as it's myo-inositol, I don't see any value in buying one that's more expensive. Unless there's some reason like you need something that's in the filler or whatever. Anyway, this one here is like $30 for a pound, and that would last a very long time. You know, so you might want to go and get a powder if you want to use high dose. That is like, what did I tell her? Like a teaspoon. I didn't figure this out, but like a level teaspoon is somewhere close to 3 grams. And then you would just say how much you wanted to do that, and splitting it out over the day, if you can, I think is a really good idea, rather than slamming yourself with a whopping dose one time a day, and getting that even kind of thing. So that's what I would recommend there. And then if we go here, I didn't really want to go there. Where was I? It was here. Oh, I know, because I did that. Boron, this is what I stock. It's not there. It's supposed to be when I click there. But anyway, we have a boron supplement. If you go to shop wondrousroots.com, you can see the boron supplement that I use there. It's Nature's Way. It's 3 milligrams, but you know, it's not the be all and end all. That's just what I stock. So anyway, it is 1:02. I think I started around 12:02, which is about an hour. Thanks for being with me, everybody. I hope you have a wonderful, wonderful weekend. And this video will be up later in the day, along with the newsletter that I'll put up and then announce that that's all available. I'm also going to be announcing our new surprise products this weekend, but probably will be tomorrow by the time I get that out. But I think you'll be intrigued and excited, and I hope you will be. Anyway, more about that to come. Thank you, everybody. And I am going to, well, let me do this, stop my share. That way I can make sure I'm seeing what everybody has said and make sure I didn't miss anything. I think we're good. Okay. So again, have a wonderful weekend. And I'll be back next week. Not sure exactly what I'm going to be talking about. What did I think I might talk about next week when I was thinking about this week? I can't remember. But anyway, thank you, Dr. May. Thanks, everyone. And it'll be something that I hope will be interesting. The things that I find interesting to me tend to be interesting to you. So I can hardly go wrong. So anyway, take care. Be well.